what do you think of complex PTSD? Because I know that's a really hot topic being debated right now.
I don't respect that conceptualization. First of all, the name, I think, is kind of insulting to post-traumatic stress disorder because people are thinking that it is divided by severity, that there's regular, typical PTSD that's easy to treat. And then there's this harder, more complicated PTSD to treat, which isn't very accurate. In fact, the traditional PTSD diagnosis actually has more of that startle response, more of the central nervous system distress, miscalibrated central nervous system. CPTSD is mostly shown up in the realm of, how they're connecting to other people, how they're relating to other people. If you actually climb up the severe ladder, there is virtually no difference between the conceptualization of PTSD, severe PTSD, and severe complex PTSD. If you put them at the severe level, the difference is entirely in personality. Some people are saying that it's exclusive, that it's just a reconceptualization of borderline personality disorder. I don't think that's true. I think that there are multiple different personality organizations that could wrap itself around repeated cumulative traumatic experiences, especially in childhood, where often personality disorders develop. But I lost my train of thought for a little bit.
Sorry, go ahead.
No. By all means.
Is there some motivation you think behind the people pushing this? It seems like they're, I'm not really sure, maybe pushing CPTSD as a way to destigmatize borderline? I don't know.
I actually think that is one of the motivations. There was a motivation to do that, I want to say about 20 years ago. They were going to call it childhood trauma disorder, and it was kind of quashed really quickly because all personality disorders are childhood trauma disorder to a certain extent. And I think this is just another attempt at that. The thing is that they have broadened it. And the more we broaden a diagnosis, the more it has concept creep. It is absorbing a lot of what we already understand from PTSD. I've already said it a handful of times that one of the features that PTSD is failing to capture is cumulative repetitive trauma. That's only in cause. The symptoms are not different. The attempt to really try to identify what symptoms are and are not traumatic, I think, is kind of a waste of time. It takes away from identifying, well, what's actually going on and how can we help it?